Hi, good evening everyone. This is Sunita. Welcome to my presentation. Today again I came with some questions to explain to you, and let's see the questions one by one in this presentation. Here you can see the first question. Clinical information such as order sets and patient education material should be reviewed at least. Clinical information such as order sets and patient education material should be reviewed at nothing but how much gap they can take to check this patient education material or any clinical information. Okay, so how much time they needed and how much gap they used to take. The answer is biennially. Biennially is nothing but 2 years. Nothing but every 2 years they used to check the clinical information like order sets and patient education material every 2 years, right? Okay, the next one, second question. Headquarters of UNESCO, nothing but United Nations Educational, Scientific and Cultural Organization. Present at. The answer is Paris. Just you remember MNOP, after O the P should come, right? So after here last word O, P will come. Okay, then P, the Paris starting letter is P. Okay, the next one, third question. The 24th World Energy Congress was held in September 2019 at. The answer is Abu Dhabi. Then the primary reason for end user testing. The primary reason for end user testing is, the answer is identifying errors. Identifying errors. So actually what is this end user testing? Once you see here, end testing is one of the testing just we can do to check the errors after earlier testing stages. Example you can see. So here the first stage they used to check errors, and again in second stage they recheck for any left errors. Again in third stage again do the test for left errors in the first stage and second stage. In the first stage they check for the errors, and in the second stage also again they check for errors which they left in first stage, is there any chance. And again at last stage we can call end user testing. Okay, so again in the last stage they check the left errors in first stage and second stage. Okay, that's why here they given that end using testing is a way to detect any problems in the software they might have been missed in earlier stage. So whatever mistakes they missed in earlier stages, again they recheck in the end user testing. Okay, the next one, next question. The famous monument Gol Gumbaz located in. The famous monument Gol Gumbaz located in. The answer is Bijapur, Karnataka. Then next one, which of the following intervention demonstrate the nurse understand about the newborn? Newborn thermoregulatory ability. Okay, so actually what it means? So what is actually newborn's thermoregulatory ability? Which of the following intervention demonstrate the nurse understand about the newborn thermal? So what is the use of this newborn thermoregulatory ability? So the use of this is, so here in this thermoregulatory machine, placing the newborn under a radiant warmer. So what is the purpose of this radiant warmer? This radiant warmer is a body warming device to provide heat to the body. For providing heat to the body, just we keep the newborn under the thermoregulatory machine. The next question you can see the situation in which individual have excessive excessive worry or belief that they are suffering from physical illness despite lack of medical advice. Lack of medical advice, so that is called, what is that? The answer is somatoform disorder. So actually what is a somatoform another name for this somatoform disorder is, you can see, we can also call hypochondriasis. Hypochondriasis is nothing but it is one of the neurological disorder or it is one of the medical disorder, and here the person experience symptoms that cannot be accounted for by medical or neurological diagnosis or unexplained physical symptom. Okay, unexplained physical symptoms cause this hypochondriasis. Nothing but here the person has the false belief that he had some disease without any medical evidence. Nothing but the person always think inside, I have some disease, I have this problem, but without any medical evidence. Without medical evidence, he is thinking that he has some disease, so that you can call the hypochondriasis. Okay. The next question, you can see all of the following are the good sources of omega-3 polyunsaturated fatty acids except, okay, so here you can see the answer, mustard oil. Except mustard oil, corn oil, fish oil, ground oil contains omega-3 polyunsaturated fatty acids. Okay, the next, which of the following is a differentiating test between mucus and CSF from the nasal discharge? Which of the following is a differentiating test between mucus and CSF from the nasal discharge? The answer is glucose. Okay, nothing but uh, two discharges you can see from the nasal cavity, that is mucus and CSF. Then how you can differentiate? How can you can differentiate this mucus from CSF? If the discharge contain glucose, so that you can call that discharge is CSF discharge. If the discharge not contain any glucose, then you can call that is a mucus. Okay, here you can see nasal discharge, the mucus, the natural discharge of mucus, actually both are in like cream in color, but here the difference is, if it is not the discharge, if it is not contain glucose, then you can call the mucus. If the discharge contain glucose, then you can say it is a cerebrospinal fluid. Okay, the next one, 10th question. When palpating the abdomen of hypertrophic pyloric stenosis infant, the nurse find that the answer is an olive-sized mass in right upper abdomen. Actually, what is this pyloric stenosis? Nothing but when we are assessing the newborn with the newborn or infant, okay, infant who has this condition, pyloric stenosis. So what you can see, a olive side masses in right upper abdomen we can see. Okay, so this is a sign the infant has the pyloric stenosis. Actually, what is this pyloric stenosis? Here you can see the diagram. The pyloric stenosis is nothing but abnormal form of narrow opening, formation of narrow uh, formation of narrow opening between the stomach and duodenum is called pyloric stenosis. Okay, here you can see, so this is the normal stomach, so this is the esophagus, stomach and duodenum. So there is no formation of any thick layer here, but here you can see abnormal formation of a layer here. Okay, and it causes narrow opening. It causes narrow opening here. So this condition is called, what is it? Pyloric stenosis. Okay, so thickened muscle you can see here. Formation of thickened muscle you can see here, but here nothing is there. Okay, so this is the this is the normal stomach and this is the pyloric stenosis stomach of infant. Then next question. thiamine as prescribed for an alcoholic patient, the rationale for administration of this medication is the prevention of. Okay, so nothing but, so what is the purpose of giving thiamine medication to the alcoholic patient? Okay, so in order to prevent which condition? The answer is Wernicke-Korsakoff syndrome. Okay, Wernicke-Korsakoff syndrome. Okay, so actually this Wernicke-Korsakoff syndrome we can also call the Wernicke encephalopathy, and this is a disorder which is caused by thiamine deficiency, and the thiamine deficiency in alcoholic patient, the main cause is due to eating disorders or malnutrition or alcohol abuse. Okay, so these are the causes. These are the alcohol abuse and malnutrition, eating disorders causes thiamine deficiency. And here for treating this thiamine deficiency, we should administer medication thiamine to this patient. Okay, and not only that, it is also called the unusual type of memory disorder due to lack of thiamine. Nothing but, in the alcoholic person, is there any thiamine deficiency, then it causes syndrome. So that syndrome is called Wernicke-Korsakoff syndrome. Okay. The next question, modify ECT is not given frequently on routine practice because of. Modify ECT is not given frequently on routine practice because of. Why? Because, so what is the meaning of this? Modify ECT in hospital, they not give preference for this modify ECT. Why they are not giving more preference for this modify ECT? Nothing but non-availability of anesthesia. Okay, so here I give you clarity. Here types of ECT based on the medication administration, the ECT, this ECT is divided into two types, that is the direct ECT and modified ECT. Modified ECT is nothing but with the drugs we administer or we give this therapy, ECT therapy we give compulsory with the medication, that is general anesthesia and muscular relaxant. But here in direct ECT, no need of giving any general anesthesia or any muscular relaxant. But when we choose this modify ECT, compulsory we have to bring the anesthetist. Okay, so because of non-availability of anesthetist in the hospital, they give more preference to this direct ECT. Okay, and they not frequently use this modify ECT. Here the next question is, the nurse is informed that a client with a large surgical incision is being transferred from the ICU to surgical unit. Nothing but one nurse is saying to the one more nurse. Okay, just she is communicating to other nurse, a client with a large surgical incision is being transferred from ICU to surgical unit. So which medication does the nurse anticipate the physician will order for this client? Okay, so the answer is ascorbic acid, nothing but vitamin C, right? Nothing but one patient is transforming from ICU to surgical unit and the patient has the large surgical incision on his abdomen. Okay, then what we can guess? Okay, what we can guess the physician can order for this client? Okay, which medication he can order for this client? The answer is ascorbic acid. Why? Because the vitamin C tablet you can say. And why? Because it facilitates better healing and faster recovery. Why? Because better healing. Why we are talking about this better healing? Here large surgical incision there. So for better healing, the physician, there is a chance to prescribe this ascorbic acid. Okay, the next question, general aptitude and general awareness. So this is the question under general aptitude and general awareness. Just you see the question here. Study the below series and identify which number can come in place of here. Okay, so three options they given. So in this fourth place, the answer we should find. Okay, so options they given, four options they given, and in that the answer is, sorry, 1296 is the answer. Okay, then how we can find this answer? You can see here. So this one, simple, nothing but we have to think ourselves. Okay, which answer will come in this fourth option. So here you can see 6 into 6 is 36. Okay, in second box they kept, okay, they multiplied 6 with 6 and the answer is 36. Again this 36 we have to multiply with the 6 and the answer is 216. Again 216 we have to multiply with the 6, again we get the answer 1296. Okay, then next, Simon Commission was group of dash parliament members. Simon Commission was group of dash parliament members of parliament. What is that? Answer is 7. And actually what is this Simon Commission? Simon Commission also called the Indian Statutory Commission, and it arrived at the time of British India in 1928. Okay, and so what is the purpose of this Simon Commission is check the government administration in India. And it how many members included in this parliament? 7 members included in this parliament during British Parliament. Okay, next question, you can see the system of evaluation where an employee is measured against his or her co-worker is called ranking method. So nothing but here, what is the ranking method? We can call in the ranking method what the employee do, what the manager do. He just compare the one employee with another employee, co-worker. Okay, then he know better how this employee working properly or not compared to this co-worker. Okay, so that method is called the ranking method. The next one, disposal of expired and cytotoxic drugs by which method? Okay, which method we can use for disposing this expired and cytotoxic drugs? Answer is separate landfill disposal. Disposal. Why? Because, so what is the purpose of following this? We can prevent harm to the environment and human health also. And here you can see the human anatomical waste, and here the categories also you can see. Category 1, category 2. So the question they asked for this category 5. Okay, so category 1 human anatomical waste, and disposal method. What disposal method we can use? Incineration or deep burial. Okay, the next one, category 2 animal waste, incineration, deep burial. The next one, category 3 microbiology and biotechnology, and the disposal method is loco autoclaving, microwaving, incineration. Then category 4 waste, sharp, needle, syringes, blade, etc. And we can dispose disinfection or chemical treatment or autoclaving, or we can also do microwave shredding also. Here they ask this question, category 5, nothing but here discarded, cytotoxic or expired. Okay, discarded medication and cytotoxic drugs or waste or outdated drugs. So what method we can use? Incineration or autoclaving or microwave also we can use. And okay, sorry, not autoclaving and microwaving. And this fifth category we can use the incineration and destruction or landfill or disposal in secure landfill. Okay, and next you can see category 7. In this category 7, solid waste, nothing but tubing, catheter and IV set. And category 6, items contaminated from blood and body fluids. Category 6 and category 7. This is the category 7 and 6 and 7. And what disposal method we can use here? Right side I written. Okay, disinfection by chemical treatment or autoclaving or microclaving, and here incineration, autoclaving or microclaving. And next category 8 liquid waste, category 9 incineration has, category 10 chemical waste. Okay, here you can see chemical treatment discharge into drain, disposal in municipal landfill, or the chemical discharge into drains or secure landfill for the solids. Okay, then the next question you can see inhibin secreted by which part of ovary, or uterus? The answer is corpus luteum. Okay, so actually what is the inhibin? Inhibin is also one of the hormone, and it is synthesis inhibitor. So what is the role of this inhibin? It stops or inhibits synthesis and release of follicular stimulating hormone. and it is also reduce the LH hormone also. And here you can see the diagram of ovary, and this is the diagram of ovary. Once you look out here, the primary follicles, secondary follicle, tertiary follicle, and this is a Graafian follicle. Okay, so this is a cycle of development, the follicular development here, and these follicular development always under the control or activated by follicular stimulating hormone. Okay, and here after tertiary follicle, it turns into Graafian follicle. So when it reaches the Graafian follicle, when the Graafian follicle ruptures, it releases the ovum. Okay, so this empty part we can call initial corpus luteum, and after it convert into mature corpus luteum. Okay, so this corpus luteum secrete the inhibin hormone. So what is the purpose of this inhibin hormone? It stops the follicular stimulating hormone. Why? So what is the role of this follicular stimulating hormone? Okay, so these all the process under the control by this follicular stimulating hormone. So here, and corpus, after mature corpus luteum, then it forms into corpus albicans. Okay, then regarding this structure, in one more class I can explain you clearly. Just now you remember inhibin is secreted by corpus luteum. The next question, modern concept of chemotherapy proposed by scientist Paul Ehrlich. So here you can see who was this person. Here he was one of the founder of chemotherapy, and he was a German physician, and not only that, he was the first scientist to develop the target pharmaceutical treatment against the syphilis. And not only that, he won Nobel Prize, and he was an, already I said that, German medical scientist, and he is one of the, he had a pioneer work in hematology, immunology, and chemotherapy also. Okay, the next question you can see, causative agent organism for infectious mononucleosis is, the answer is Epstein-Barr virus. Actually, what is this mononucleosis? This mononucleosis is one of the contagious viral infection that cause fever, sore throat, swollen lymph nodes. Okay, and we can also call this mononucleus kissing disease or glandular fever, and this disease spread through saliva, so that's why we can call this is one of the kissing disease. Okay, during kissing it transfer from one person to another person. The next one, most relevant knowledge about the oxygen administration to client with COPD. The answer is oxygenate 1 to 2 liters minimum oxygen we should give the people who has this COPD. So more oxygen we should not give this person. So the minimum, how much we need to give? 1 to 2 liters per minute to maintain the hypoxic stimulus for breathing. Okay, the next one, the patient has to undergo a loop electrosurgical excision procedure, LEAP. Which of the following represent the potential long-term complication from this procedure? Nothing but the person who is going for this procedure, electrical surgical excision procedure. So what complication we can see in this patient? The answer is cervical incompetence or cervical stenosis. So what is the cervical incompetence? We can call the cervix opens too early before delivery. The cervix open too early. So this is one of the complication. The persons who went, the woman who went for this lip procedure. Okay, lip here. Actually, you can see the complete detail of complete information about this. So actually, what is this? This is a surgical procedure, and what is the purpose of doing this surgical procedure? To remove abnormal tissue from the cervix using a heated wire loop. Okay, nothing but, so by using the electrical current, they insert a device to the vagina, and so what is the purpose of doing this procedure? Just they remove the abnormal tissue around the cervix. For removing abnormal tissue around the cervix, and they do this procedure. And not only that, this procedure takes place 20 minutes, and the recovery period is minimum 4 weeks. Okay, the next normal value of some important substances in the blood. Okay, glucose, here you can see the normal values. Glucose 72, okay. Glucose 72 110 mg per deciliter. Creatine, cholesterol, plasma proteins, bilirubin, iron, copper, calcium, sodium, potassium, chlorine and bicarbonate. Okay, just here once you look out, so what are the normal values are there for this particular substances. Thank you.